Well, let's shift gears now and discuss a national quality improvement effort aimed at improving the safety of our responses and transports with Dr. Michael Redlenner. Dr. Redlenner is an associate professor in emergency medicine, the Icahn School of Medicine at Mount Sinai in Manhattan, New York. He is the emergency department associate medical director there at Sinai and the medical director for their EMS quality improvement department. He is also the co-director of NEMSP's quality and safety course and the president of the National EMS Quality Alliance, or NEMSQA. All right. Well, Dr. Redlenner, thank you very much for joining us. You know, I think what I'd like to do to start is ask, what is a performance measure guy like you doing in a quality improvement process like this? What is your involvement with this? We know what you do with NEMSQA, but how'd you get involved with quality improvement?
Well, Dr. Jarvis, it's a pleasure to be here today. And I think that you could probably attest to the fact that the group at NEMSQA, at the National EMS Quality Alliance, is very much involved with quality improvement in general. And this project with Red Lights and Sirens, or Lights and Sirens, is just a natural fit for us. And it really dovetails nicely with the work that we do at NEMSQA on a daily basis, on a weekly basis. And it puts into play the work that we've done, and it really makes it, it implements it on the ground level. And I think when at least from my perspective, when I think about this, that is where we want to be. That's where the National EMS Quality Alliance wants to be. We want to be at a place where we're creating effective quality measures that are useful and really give agencies and organizations the ability to put the evidence of this work into practice.
So I remember when we first started talking, when you were talking to me about serving on NEMSQA, and really the pitch you had is the Q in NEMSQA is really the whole reason we're doing this. It's to improve quality. And now we have this really specific, targeted improvement effort. Can you walk us a little through what the structure of this quality improvement effort is? You know, who's funding it, who's involved with it, and what it's who's actually getting the work done, if you will? Because there's always somebody behind the scenes making things happen.
Well, firstly, I would say that this is a huge collaborative effort with a number of partners from across the country. Mike Taigman is one of the great minds who's really pushed this project along, and Dr. Doug Kupas and the whole group, the expert panel that we've been working with, has helped us to shape this endeavor. We have at NEMSQA, Cherie Murphy is our executive director, and she has really been kind of the machine that makes this work. We have invested through our organization's funding in some of the products that we use for this project. So in some of the quality improvement software and some of the ways that we organize the data that's coming in from the project, we have invested in this. Otherwise, it's mostly a volunteer effort, honestly. We're hopeful that we'll find some funding at some point in order to, as people see the value of this, they'll want to come and fund some of these efforts at real improvement across the country.
I absolutely echo your shout out to Cherie. She does amazing work. I've been really impressed with the amount of excitement about this particular project, about reducing red light and siren use. But I'd like to get your thoughts about this, because when you're thinking about this initiative, you're not thinking necessarily just about red light and siren. Is that right?
So, no, that's a great point, Jeff. I would say that this EMS, it's a part of what we're envisioning as a larger effort to improve quality in a number of areas. And we hope that this serves as a model for something called the EMS Quality Improvement Project, which is, we hope that this is the first one where we take an initiative like this, we gather folks in a breakthrough collaborative model with the IHI that we've decided to use through this. Actually, Mike Taigman is our guru when it comes to the improvement science backbone of this project. But what we hope to do is really engage this idea with NEMSQA quality measures, essentially create a better practice environment.
So it's interesting because when I was interviewing Mike, I called him the guru of quality improvement too, and I'm not sure he knew what to do with that, which is ironic since I don't think either one of us are the first person to call him that. He's done amazing work. Well, speaking of that, when I got interested in quality improvement, Mike was one of the people I went to. You were one of the other people I went to. For our listeners and our viewers, if they were really interested in learning about quality improvement and wanted to maybe immerse themselves in an ongoing learning process, is there like a course that's available to them? How could they learn about this?
That's a great
How
one
about
to
low
plug
hanging
there, Jeff.
just
So
pitches?
yeah,
Yeah.
my involvement in quality goes back to when I started in EMS about a little more than a decade ago, and I became a new medical director at my organization, and I was asking the questions about, well, how do I know if we are doing a good job? How are we doing a good service? And I started looking around, and again, I I gravitated towards quality measures and thinking about like, well, how am I going to measure how well we're doing in terms of the service, the medical service that we're providing for our patients? And I wouldn't say I couldn't find anything, but I couldn't find something that was established, that was evidence based, that really was portable into my environment without a lot of work and a lot of effort. And so I got interested in how do you think about measuring the quality that we want to see in the care that we provide to our patients. And so, I found National Association of EMS Physicians, which is a natural home for an EMS physician like myself. And on the quality committee, we started talking about, education and trying to get folks engaged in a better process to understand how they're doing quality, not just through chart review, but also, but thinking about how you look at the system. I started down this road of quality improvement, and we founded the National Association of EMS Physician Quality and Safety course, and it's a year-long course. We use the Institute for Healthcare Improvement model for improvement. We nestled it really deeply within the EMS context, and so over the last 5 years, we've had EMS leaders and quality folks join this course, both kind of a local 2-day course model, and then also a year-long course where we've had now graduated 4 classes of folks who are now doing great improvement work. We're going to be doing a fellows course coming up in the spring. We're hoping to graduate folks who are interested in really changing the way we think about quality.
I can tell you it is really exciting to see the impact that course is having. I'm just seeing all of these disciples pop up throughout the profession, and they are really passionate about driving performance using the things they've learned, the improvement science. All right, so we've been building these disciples over the last 4 years. What is it about the environment now that made you think, right now, the iron is hot, let's get in and start doing some grassroots quality improvement?
So there's a confluence of factors that are making the time right for a national quality improvement like the Lights and Sirens project. One is that we have leaders, like we were discussing, that are coming out of these quality courses that are ready. Also, the access to electronic medical records and the electronic data in general allows us to look at large-scale data quickly and measure it over time quickly without doing a manual chart search. There obviously is the recent position statement on Lights and Sirens by the many national organizations that has put this at the forefront of our discussion. The science has been building for a long time. We know that use of Lights and Sirens is something that will save lives if we decide to use them effectively and appropriately, and in a limited fashion.
So I think that's a really great point. The idea that you can get 14 national organizations, all associated with EMS, to sign on to the same position and to push it is just absolutely amazing to me. I can't think of a time that that's happened before. So, and the fact that it is happening around something that is so important, saving the lives and health of our providers, I think it's a really good thing. We've been talking in some generalities, we have this software platform, Simple QI. We have this initiative with opening up to 50 organizations to begin with, so we can work the kinks out and then move forward to a larger organization. What are some of the specific things we've been seeing, some of the specific changes that organizations have been doing to try to improve their performance on safe responses and safe transports?
It's a great question, Jeff. Well, I think what we are seeing is very exciting for anybody who is interested in how things change. There are 50 organizations with 50 different approaches. I would say one at the dispatch level. I go back to Doug Kupas and the group who think that lights and sirens is a medical intervention, right? And so you have to weigh the risks and the benefits of it. And that debate within the provider community is really strong, right? We are deeply ingrained to think that using lights and sirens is going to benefit our patients. And it may be true in a small percentage of folks, right, when we're responding to critical calls that require most rapid response. However, essentially, we know the science behind this, and that we can do non-lights and sirens transport with, safely and effectively. And but I think there's a lot of a psychological barrier with many of our providers who think that they're not doing the best that they can for their patients. And I think that this is something that we'll need to address specifically. This is a big topic of conversation among the agencies that are involved. The other thing that I would mention briefly is thinking about how do you integrate lights and sirens into medical protocols around response. And I think we're looking at that deeply. I think a number of organizations have touched on that. We are developing PDSAs, Plan, Do, Study, Act cycles to identify what specifically is going on in each organization and agency, and using those to identify how to overcome some of these common and understandable barriers.
Well, speaking of reducing lights and sirens, I heard some in the background there. Well, I heard the sirens, probably didn't hear the lights very much, but I'm guessing they were going. And since you're in New York City, and I've driven with lights and sirens in New York City before and realized that it's mostly a futile gesture, I'm guessing people weren't getting out of the way.
Yeah, that's a big problem right here.
Kind of hard to get out of the way when there's nowhere to go.
Yeah.
Well, so one of the things that I saw, you talked about attitudes, about providers and their concern that they're not doing the best for their patients. The MedStar system actually uploaded a list of surveys that they're doing, surveys of the public, surveys of providers. And we looked at that and we just adopted that. We changed some of the verbiage and we sent those out to gauge the opinions and attitudes of our folks so that we can then target our educational efforts to those attitudes. I think that's really, really important.
Jeff, I think that is one of the key points that a quality improvement project like this does. It takes lessons learned from one organization or agency, and it allows them to be applied very specifically to another organization. Again, like you said, with just a subtle difference. One thing I would say also, just a point that you had mentioned earlier, that there's 50 organizations that are involved with this right now. We've had a lot of internal discussions around making the learning available to any organization that wants to be a part of this. This is not an exclusive project. This is a way to start small and grow bigger. Some agencies I've heard feel a bit left out of this, but the reality is that's not the point.
Yeah, and it's interesting. You mentioned the United States and Canada because we have some colleagues from Canada who are doing great work in this area. But you're right, we don't want it to be exclusionary, and the lessons that we learn are just as applicable to the systems in London or Rio de Janeiro or Tokyo as they are in New York City or Austin, Texas. So, and we want to make that learning available to everybody. So, Michael, what is the goal of this initiative? We're all about measurement, right? So let's put some numbers on it. What's the goal?
Well, Jeff, let me start by saying the more general idea. So really what we're trying to accomplish is to increase the percent of safe transports without the use of lights and sirens. And so when we think about it, and it's really a funny story, we've talked a lot about this in the improvement project group with not just a little bit of disagreement, but I'll turn it over to you to kind of describe the rationale for it.
Yeah, sure. So the disagreement here is we have two measures: Safety 01, which is the proportion of 911 responses without lights and sirens, and Safety 02, which is the same one for transports. Why are we doing these as what are essentially inverse measures? Why are we measuring the lack of lights and sirens? Well, and the reason is because all of our measures, not just the safety measures, but all of the measures throughout NEMSQA are designed where higher performance is better. We're trying to encourage the behavior that we want to see. So we carried that across to the two safety measures. These safety measures were in place long before the QI initiative came around. So what we're looking for, what we want to see, is safer responses to the scene, safer transports to the hospital. And what we know from the science is not using lights and sirens increases safety. So that's the reason they're set up the way we are.
I couldn't say it better, Jeff. So for the
Almost like I've had some experience explaining
yes,
this.
yes, good. I unfortunately we have to explain a little bit, but I do think that there is some, like you described, a rationale to doing it. So for the National Quality Project, we are looking for 70% of responses to the scene to be without the use of lights and sirens. And we're looking for 90% of transports to the hospital to be done without lights and sirens. And so we think that these numbers take into account some of the variability, some of the concerns about the rapid response using lights and sirens that is held among the EMS community. And we think that that's a reasonable number for organizations to aim for.
Yeah, I think you're right. And I know that we will get a lot of pushback, perhaps from some higher performing agencies that say, why are you setting the bar so low? And I said, well, my thought on this is, that old adage, don't let perfection be the enemy of better. And yes, I think we would all love to see 85% of responses, 100% of transports, or 98% of transports. But what we want is better. And we'll accept better over perfection any day, because perfection is not likely to happen. The other thing I think is really important for us to understand is we are talking about reduction of lights and siren, not elimination, because we recognize that, like any medical intervention, sometimes there are places where it's warranted. Cardiac arrest jumps to mind for our responses. I think it's important that we say we're not trying to take your lights and sirens away. We're just trying to help you use them better. Dr. Redlenner, thank you so much. I really appreciate the time.
Thank you, Dr. Jarvis. It's a pleasure as always, and your partnership at NEMSQA has been invaluable. So we look forward to continuing those efforts.
You've been listening to the EMS Lighthouse Project podcast, a proud member of the FlightBridge Ed podcast family and a Fire Dog production. Visit flightbridgeed.com for more information.